Hello, this is Janice, and for the next hour, I'll be reading from the August issue of Healthy Living on the Niagara Frontier Radio Reading Service. Cyclospora Outbreak: How to Protect Yourself While Enjoying Fresh Produce. A growing outbreak of Cyclospora, a microscopic parasite that causes severe diarrhea, has prompted health officials across the United States to investigate one of the largest foodborne illness outbreaks in recent years. While the source has not yet been confirmed, investigators believe contaminated fresh produce, possibly lettuce or salad greens, may be responsible for many of the reported cases. Although the news may sound alarming, experts emphasize that there is no need to stop eating fruits and vegetables. Fresh produce remains an important part of a healthy diet, and the overall benefits far outweigh the current risk. Instead, they recommend following a few simple food safety practices to reduce your chances of becoming ill. Cyclospora is a parasite that can contaminate food or water through contact with infected human waste. Unlike many stomach viruses, it does not spread directly from person to person. Symptoms usually appear 1 or 2 weeks after exposure and may include watery diarrhea, stomach cramps, nausea, fatigue, bloating, loss of appetite, and sometimes weight loss. Without treatment, symptoms can last for several weeks or even longer. The good news is that there are several steps you can take to protect yourself. Wash fresh fruits and vegetables thoroughly under cool running water before eating, cutting, or cooking them. Wash your hands with soap and water before handling food, and clean cutting boards, knives, countertops, and refrigerator shelves regularly. Experts do not recommend washing produce with soap, bleach, vinegar, baking soda, or commercial produce washes, as there is no evidence that these methods remove cyclospora more effectively than running water, and some may leave harmful residues. Whenever practical, cooking vegetables provides an added level of protection because heat destroys the parasite. While many foods linked to cyclospora, such as lettuce, herbs, and berries, are often eaten raw, properly cooked foods are not considered a source of infection. If you develop persistent diarrhea lasting more than a few days, especially after eating fresh produce or traveling, contact your healthcare provider. Cyclospora is not routinely included in standard stool tests, so your provider may need to order a specific test if the infection is suspected. Fortunately, once diagnosed, the illness can usually be treated successfully with prescription antibiotics. Public health officials continue to investigate the outbreak and expect to learn more in the coming weeks. Until a specific food source is identified, the best advice remains simple. Continue enjoying a diet rich in fruits and vegetables. Practice good food safety habits and seek medical care if symptoms become severe or prolonged. He saved my life. How local acupuncture is helping Buffalo residents reclaim their lives. My feet and legs were excruciating, and my doctor told me they could do nothing. I was told I would have to take gabapentin for the rest of my life. Peripheral neuropathy is the pain, discomfort, and numbness caused by nerve damage to the peripheral nervous system. Cheryl explained that daily tasks like opening doors and using the bathroom were overwhelmingly painful. How can you live the next 30 years when you don't even want to get out of bed to do simple things? She was experiencing the burning, numbness, tingling, and sharp pains that those suffering from neuropathy often describe. The way I would describe it, it's equivalent to walking on glass. Cheryl hadn't worn socks in 5 years and was wearing shoes 2 sizes too big so that nothing would touch her feet. Unfortunately, Cheryl's story is familiar to over 32 million Americans suffering from peripheral neuropathy. If you're unfortunate enough to be facing the same disheartening diagnosis, you may not be sleeping at night because of the burning in your feet. You may have difficulty walking, shopping, or being active for long before neuropathy stops you in your tracks. You may be struggling with balance and living in fear that you may fall. Your doctor told you to find a way to live with the pain, and you're taking medications that aren't working or have uncomfortable side effects. Jonathan McDonald, the founder of Buffalo Advanced Medical Acupuncture in Cheektowaga, is utilizing the ancient, time-tested practice of acupuncture and a technology initially developed by NASA that aims to increase blood circulation and expedite recovery and healing to treat this debilitating disease. Fortunately, Cheryl read about Jonathan McDonald and the work he was doing to treat those suffering from peripheral neuropathy without invasive surgeries or medications. Now I don't have those shooting pains when I go to bed at night. I don't have that burning sensation. I don't have pain coming up my legs. Cheryl describes life after receiving her treatments. I can wear socks and shoes again. Cheryl now runs a successful dog walking business and even covers up to 5 miles daily by herself. It's life-threatening. Jonathan gave me more than I could have hoped for. He saved my life. Jonathan has been helping Western New Yorkers for over 20 years, using the most cutting-edge and innovative strategies. In chronic pain cases, specifically those that have been deemed hopeless and untreatable, he consistently generates unparalleled results. If you've missed too much time with loved ones because of pain, or you've passed on going out with friends because you're afraid of falling, it's time to call Jonathan McDonald and the team at Buffalo Advanced Medical Acupuncture. What to know about seniors and vaccines. Parents know that vaccination is a key part of caring for young children. The American Academy of Pediatrics advises parents to vaccinate children against a range of diseases and conditions during the first 12 to 18 months of a child's life, and that early immunization helps children build immunity at the best time, before they're exposed to germs that can make them very sick. But what about seniors and vaccines? Are immunizations still a vital part of a wellness routine for older adulthood? The National Institute on Aging, NIA, advises older adults to speak with their doctors or pharmacists about the vaccines they need, which may help prevent or reduce the severity of various diseases. COVID-19. The NIA notes that age is a risk factor for serious illness from COVID-19. Because COVID-19 is still relatively new, researchers are still learning about the effectiveness of vaccines against new variants of the virus. Older adults are more likely than younger people to become seriously ill from COVID-19, so it's imperative that seniors discuss immunization against the virus with their physicians. Influenza. The World Health Organization reports that the flu kills as many as 650,000 people worldwide each year. A 2009 study in the journal Influenza and Other Respiratory Viruses found that most influenza-related deaths in industrial countries occur among seniors aged 65 and older. The flu spreads easily from person to person, and the NIA advises everyone aged 6 months and older to get an annual flu vaccine. While protection from a flu vaccine can wane over time, particularly in older adults, a flu shot still reduces the likelihood of serious illness and/or hospitalization. The Centers for Disease Control and Prevention recommends that seniors age 65 and older receive a higher dose or adjuvated flu vaccine, the latter of which helps create a stronger immune response than a standard flu shot. Seniors are urged to speak with their physicians about which flu shot is right for them. Respiratory syncytial vaccine, or RSV. The NIA indicates that RSV is a common virus that often produces mild cold-like symptoms. However, older adults should know that they are at higher risk of developing severe symptoms if infected with the RSV. The NIA notes that RSV can be particularly dangerous for older adults with chronic diseases or weakened immune systems. Hospitalization or even death can occur after severe RSV symptoms develop. RSV vaccines can prevent serious health programs, and the CDC urges seniors to speak with their physicians about immunization. Doing so before the peak RSV infection season, which is fall and winter, is ideal. And pneumococcal diseases. The CDC advises that all adults age 50 and older receive a pneumococcal vaccination. Pneumococcal disease is a serious infection that the NIA notes often causes pneumonia. The risk of becoming very sick or dying from pneumococcal disease is higher among older adults than among younger people. There are different forms of the pneumococcal vaccine, and seniors can speak to their physicians about which one is best for them. Immunization schedules begin shortly after birth, and seniors still have much to gain from vaccination. You are listening to a reading of articles and features from Healthy Living on the Niagara Frontier Radio Reading Service. Tick-borne diseases are on the rise. What you need to know. If it seems like ticks are everywhere this summer, you're not imagining it. Health experts across the Northeast are reporting larger tick populations and a growing number of tick-borne illnesses. While Lyme disease remains the most common, it is no longer the only disease people should be concerned about. According to the Center for Disease Control and Prevention, CDC, warmer winters, longer growing seasons, expanding deer populations, and changes in land use have all contributed to the spread of ticks into new areas. As a result, people are encountering ticks more often and for more months of the year than in the past. Western New York is among the regions seeing increased tick activity. The New York State Department of Health reports that Lyme disease continues to be the state's most common tick-borne illness. But infected ticks are also carrying organisms that cause anaplasmosis, babesiosis, and the rare but potentially serious Powassan virus. Lyme disease, caused by the bacterium Borrelia burgdorferi, often begins with fever, fatigue, headache, muscle aches, and in many cases, the familiar bullseye rash. However, not everyone develops the rash, making early diagnosis more challenging. Anaplasmosis produces flu-like symptoms, including fever, chills, severe headache, and muscle aches. It is usually without a rash. Babesiosis is caused by a parasite that infects red blood cells and can be especially dangerous for older people or people with weakened immune systems. Powassan virus remains uncommon, but it has attracted attention because it can be transmitted much more quickly than Lyme disease and may cause inflammation of the brain or spinal cord. Researchers are also monitoring the spread of the Lone Star tick, which has been moving northward into parts of New York. Its bite has been linked to alpha-gal syndrome, an allergic reaction that can cause people to develop an allergy to red meat and other mammal-derived products. Another concern is that a single tick may carry more than one disease-causing organism. This means some people may develop multiple infections from one tick bite, making diagnosis and treatment more complicated. The good news is that tick bites are often preventable. The CDC recommends wearing long sleeves and long pants when walking in wooded or grassy areas, using EPA-approved insect repellents containing DEET or picaridin, and treating clothing with permethrin when appropriate. After spending time outdoors, carefully check your body, clothing, children, and pets for ticks, and shower as soon as possible. If you find an attached tick, remove it promptly with fine-tipped tweezers, grasping it close to the skin and pulling straight upward. Most importantly, don't ignore symptoms that develop after a tick bite or outdoor exposure. Early diagnosis and treatment greatly reduce the risk of serious complications from Lyme disease and other tick-borne illnesses. As tick populations continue to expand across New York, a few simple precautions can help you enjoy the outdoors safely all season long. The benefit of professional dog grooming. Courtesy of Karamia Pet Resort. Companion animals' needs are high on pet owners' priority lists. Dog owners want to ensure their pets are healthy and happy, which requires attending to the dog's hygiene. Dog grooming is a key component of keeping a dog neat and trim. Although grooming a dog can be a do-it-yourself endeavor, There are notable advantages to entrusting this important task to a professional groomer. The American Kennel Club says that grooming a dog requires patience and care, especially when handling a young dog or a pet with behavioral issues. A professional groomer can save pet owners time and money. The following are several reasons why dog owners may want to leave dog grooming to a professional. There is no need to purchase supplies. Professional groomers have the tools to get the job done right and make a dog look its best. From clippers and rounded scissors to a table that makes it easier to secure and access the pet, groomers are equipped with everything they need. Groomers also have an array of shampoos and treatments to handle various coats or skin conditions. Groomers can gingerly remove mats and tangles. They have the skills to handle them safely. These coat conditions can pull on the skin and cause discomfort. Professional techniques focus on removing mats and tangles gently and efficiently, something a non-professional may not be able to do easily. And groomers may spot ailments. They will closely examine the pet's skin and coat, making them more likely to notice unusual spots, bumps, irritations, or even pests like fleas and ticks. Groomers will handle icky tasks. A groomer will tackle tasks that may be off-putting to pet owners, such as cleaning anal glands or washing a skunk-sprayed dog. They can also remove ticks and fleas. Groomers can safely trim nails. Trimming a dog's nails, especially those of skittish pets, can be challenging. Veterinary Healthcare Associates explains that a dog's nails contain a quick, which appears as a small pink center. This area is very sensitive and contains blood vessels. It's essential to avoid the quick when trimming nails. Otherwise, the dog can experience pain and bleeding. The frequency of professional grooming depends on several factors, including breed, coat length, and how dirty the dog gets. Some at-home touch-up brushing and grooming can also extend the time between visits. Ultimately, pet owners can find the right balance to keep a dog comfortable, clean, and looking dapper. What parents can do to avoid overscheduling students. The new school year offers a fresh opportunity for students. For parents, it often means a return to the hustle and bustle of school-age children. They may also wonder whether their children are overscheduled and how that might affect their classroom performance. A 2024 study in the journal Economics of Education Review found that students may face adverse consequences from what's piled onto their plates during the school year. The study found that the amount of homework students receive and the abundance of extracurricular activities they participate in are not helping them build their academic skills and are harming their mental health by increasing feelings of anxiety, anger, and depression. Deciding where to draw the line on students' schedules is not an exact science. However, parents can consider several strategies to avoid overscheduling their kids in the coming school year. Take an age-based approach. While structured activities can benefit kids of all ages, some childhood development experts note that organized activities may be less beneficial for younger children than for older kids. Andy Stallman, a clinical and developmental health and psychology specialist and the childhood and play expert at Imagination Playground, says that organized activities before ages 6 and 7 are not developmentally appropriate. Stallman notes that at this age, kids should be encouraged to discover their own interests through self-directed play and exploration. Kids can still engage in organized activities at this age, but the focus should be on fun and socialization rather than on building skills and improving performance. As kids advance through elementary school, parents can talk to them about organized extracurricular activities and which ones, if any, they want to participate in. Maintain an ongoing dialogue about the schedule. Parents understandably don't want kids to quit, but kids should be encouraged to let mom and dad know if they feel they have too much on their plates. The American Academy of Child and Adolescent Psychiatry, AACAP, recommends that parents encourage kids to be open about their schedules, especially if they feel overwhelmed by their obligations, and reassure them that it's all right and healthy to take a break. The AACAP also urges parents to talk with kids about their thoughts and feelings when children repeatedly resist an activity. Learn to spot the warning signs of an overscheduled child. Children do not want to disappoint their parents, so even those encouraged to share their thoughts about their activities and schedules may hesitate to speak up if they feel overwhelmed. With that in mind, parents can learn to recognize early warning signs that a child may be overwhelmed. The AACAP notes that these signs include making excuses or refusing to attend an activity, feeling overly tired or not getting enough sleep, exhibiting organizational problems or struggling to meet deadlines, declining school grades, unexplained physical symptoms such as headaches or stomach aches or increased anxiety. It can be difficult for parents to avoid overscheduling their kids, but it's important to remember the value of free time for children. Visit aacap.org for more information on striking a balance in children's schedules. You are listening to a reading of articles and features from Healthy Living on the Niagara Frontier Radio Reading Service. Why managing high blood pressure is important. High blood pressure, also known as hypertension, is also known as hypertension. It's one of the most common health conditions affecting adults. Often called the silent killer, high blood pressure usually has no noticeable symptoms, yet it can cause serious damage to the body over time. Because many people do not realize they have hypertension, regularly monitoring and proper management are essential for maintaining long-term health. Blood pressure is measured with two numbers. The top number, called systolic pressure, reflects the force of blood against artery walls when the heart beats. The bottom number, called diastolic pressure, reflects the pressure when the heart rests between beats. According to current guidelines, normal pressure is less than 120/80 mmHg. Consistently elevated readings may indicate hypertension and should be discussed with a healthcare provider. If left untreated, high blood pressure can have serious consequences. It increases the risk of heart disease, heart attack, stroke, kidney disease, vision problems, and cognitive decline. Hypertension forces the heart to work harder than normal, which can weaken the heart muscle and damage blood vessels throughout the body. Over time, this damage can lead to life-threatening complications and a reduced quality of life. Fortunately, many effective treatment options are available. Commonly prescribed medications for high blood pressure include diuretics, ACE inhibitors, angiotensin receptor blockers or ARBs, beta blockers, and calcium channel blockers. These medications help control blood pressure and reduce the risk of complications. Patients should always take medications as prescribed and consult their healthcare provider before making any changes. In addition to medication, lifestyle changes are critical to blood pressure management. Maintaining a healthy weight, following a heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins, reducing sodium intake, exercising regularly, limiting alcohol, avoiding tobacco, and managing stress can all help lower blood pressure naturally. Even modest improvements in these areas can yield meaningful health benefits. Maintaining normal blood pressure offers numerous benefits. It reduces the risk of cardiovascular disease, protects the kidneys and brain, boosts overall energy, and supports a longer, healthier life. Effective blood pressure control can also reduce healthcare costs associated with treating chronic illnesses and emergency medical events. Monitoring blood pressure between doctor visits is often a good idea, especially for individuals with hypertension or those at higher risk. Home blood pressure monitors are widely available and can help identify trends, assess treatment effectiveness, and provide valuable information for healthcare providers. Regular monitoring, combined with healthy lifestyle choices and appropriate medical care, is one of the best ways to protect your heart and prevent serious complications associated with high blood pressure. The health condition nearly 90% of U.S. adults have. Most people think of heart disease, kidney disease, diabetes, and obesity as separate health problems. Increasingly, experts are recognizing that they are deeply connected. The American Health Association, AHA, calls this connection cardiovascular kidney metabolic, or CKM syndrome. According to the AHA, CKM describes the interplay among cardiovascular disease, kidney disease, type 2 diabetes, and obesity. When one of these systems is affected, it can place added stress on the others, creating a cycle that increases the risk of serious illness. The numbers are startling. A 2024 study published in JAMA found that nearly 90% of U.S. adults met the criteria for CKM syndrome at stage 1 or higher, while about 15% had advanced CKM syndrome. Stage 1 can include excess weight, increased waist circumference, or prediabetes, conditions many people may not realize are already affecting their long-term health. The AHA describes CKM syndrome in stages, ranging from stage 0 with no identified risk factors to stage 4, which includes established cardiovascular disease and may include serious kidney disease. The goal is to identify risk early before significant organ damage occurs. The good news is that CKM health can improve. The American Heart Association recommends paying close attention to blood pressure, cholesterol, blood sugar, weight, and kidney function. Healthy eating, regular physical activity, adequate sleep, avoiding tobacco, and appropriate medical care can help slow or sometimes reverse progress. CKM syndrome changes the way we think about chronic disease. Rather than treating the heart, kidneys, weight, and blood sugar as separate concerns, physicians are increasingly looking at the whole person. Regular checkups and early screening matter. Knowing your numbers today may help protect your heart, kidneys, and overall health for years to come. Heroic efforts of the team that saved Ian's life. It was a typical day in May at Williamsville South High School when Ian Totanji, a freshman, collapsed and stopped breathing on the football field during a kickball game. It was also an ordinary day for Ian's mom, Lindsay Totanji, an English teacher at Maple East Elementary School, when she received a call from Ian's assistant principal. Not wanting to alarm me, he told me Ian had been hurt and that I needed to get to the school. Ryan Hayes, Ian's PE teacher, quickly administered CPR. Travis Denman, another PE teacher, retrieved the school's automated external defibrillator, AED, while Cruz Ramos, another student, called 911. Daniel Gerzone, a senior student, volunteer firefighter, and ETM, arrived and rushed to Ian's aid. Ryan, Daniel, and Sandy Pinella, the school nurse, alternated CPR. In addition to using the AED, Daniel placed an ambu bag, a portable breathing unit, on Ian. Lindsay said it was a miracle. Daniel was there to help only because his lacrosse coach moved his team's practice to an earlier time. Daniel's ability to use the AED restored Ian's heart to a normal rhythm. Although Ian lost consciousness and stopped breathing, he never lost oxygen flow to his body. When the ambulance arrived to take him to Golisano Children's Hospital, Ian had a pulse, was breathing, and I could accompany him. Ian's father, Freddie, met us at the hospital, where Ian remained in the pediatric intensive care unit for 8 days. While cardiac arrest in a child is typically due to a blow to the chest or genetic factors, Ian's test revealed no abnormalities. He now has an implantable cardioverter defibrillator, an ICD, which will prevent this from happening again. His defibrillator battery needs replacement every 13 years, and the lead to his heart every 30 years. Best of all, Ian has been cleared to play his favorite sport, baseball, but he is no longer able to play contact sports. According to the American Heart Association, 90% of cardiac arrests are fatal, and 23,000 children experience cardiac arrest each year. Knowing that immediate CPR and proper AED use can double or triple a person's chance of survival, Lindsay hopes to collaborate with the Heart Association to offer CPR and AED training in our community. Lindsay, Freddie, and Ian's sister Lila, who attends Mill Middle School, are incredibly grateful for the coordinated efforts of the heroic team that saved Ian. Reminding people that cardiac arrest is not rare, but surviving cardiac arrest is. Lindsay said we need to acknowledge the crucial role of bystanders. The more people trained in CPR and AED, the more these devastating statistics can be changed. The entire team of Williamsville South rescuers will receive the Heart Saver Hero Award from the Heart Association and the Buffalo Bills for their efforts during the first preseason game at the new Highmark Stadium on August 15th, where you can also meet Ian and his family. The Heart Association encourages people to attend the Buffalo Heart Walk on September 12th. How do you know when you need a hip replacement? Hip pain isn't something most people expect to become a major part of everyday life. Initially, it may involve stiffness when getting out of bed, soreness after a long walk, or groin pain. Over time, however, discomfort can become persistent pain that interferes with work, sleep, exercise, and climbing stairs. So when is it time to consider a hip replacement? One of the most telling signs is pain that no longer responds to conservative treatments. Often, people experience significant relief with physical therapy, weight management, activity modification, anti-inflammatory medications, or injections. When these approaches no longer provide lasting improvement, it may be time to discuss surgical options with an orthopedic specialist. Another important indicator is loss of mobility. If your hip is still so sore that getting in and out of a car, walking through the grocery store, or enjoying hobbies has become difficult, your quality of life may be suffering more than you realize. Many people gradually adjust to these limitations without recognizing how much they have given up. Pain at night is another warning sign. Healthy joints shouldn't keep you awake. If hip pain regularly disrupts your sleep or persists even while resting, it may indicate more advanced joint damage. Most hip replacements are performed because of osteoarthritis, the gradual wearing away of the cartilage that cushions the joint. As cartilage deteriorates, bone rubs against bone, causing pain, stiffness, inflammation, and reduced range of motion. Previous injuries or avascular necrosis can also lead to severe hip damage. Fortunately, today's hip replacement procedures are more successful than ever. Advances in surgical techniques that eliminate the need to cut through muscle and in spinal anesthesia, pain management, and rehabilitation are helping patients recover more quickly than in the past. It is common for people to be up and walking, even going home the same day as surgery, and returning to many of their normal activities within weeks. Perhaps the biggest misconception is that patients should wait until the pain becomes unbearable before seeking help. However, waiting too long can lead to further loss of strength, reduced mobility, and a more difficult recovery. An orthopedic evaluation can determine whether your symptoms originate in the hip or stem from another condition, such as a problem in the lower back. Hip replacement isn't the right answer for everyone, and surgery is rarely the first treatment recommended. However, if hip pain is limiting your independence, keeping you from enjoying life, or preventing you from doing the things you love, it may be time to have the conversation. The goal of hip replacement isn't simply to replace a joint. It's to help people move with less pain, regain independence, and return to the activities that matter most. You are listening to a reading of articles and features from Healthy Living on the Niagara Frontier Radio Reading Service. AI Myths and Reality, What Everyone Should Know. Artificial intelligence, or AI, is transforming how we work, learn, communicate, and even receive medical care. Yet, despite the headlines, AI remains one of the most misunderstood technologies of our time. Some believe it will replace nearly every job. Others worry it will think like humans or consume so much energy and water that it will threaten our future. The truth is far less dramatic and far more interesting. According to the National Institute of Standards and Technology, NIST, AI analyzes data, recognizes patterns, makes predictions, and assists with decision-making. It does not think, feel, reason, or possess common sense the way people do. Like a calculator or GPS, AI is a powerful tool whose value depends on the knowledge, judgment, and ethics of the person using it. Myth number 1, AI will replace people. Perhaps the biggest fear surrounding AI is that it will eliminate jobs. History suggests a more balanced outcome. The Industrial Revolution, computers, and the Internet changed the nature of work while creating entirely new careers. The World Economic Forum predicts AI will automate some routine tasks while creating millions of new jobs requiring problem solving, creativity, communication, and technical skills. Rather than replacing people, AI is changing how many of us work. Those who learn to use it effectively will likely have an advantage. Myth number 2, AI can replace doctors and other professionals. AI is becoming an invaluable assistant in medicine. It can help physicians analyze medical images, review research, predict disease risks, and personalize treatment and recommendations. But AI cannot replace experience, judgment, or compassion. The American Medical Association emphasizes that physicians remain responsible for every clinical decision. Surgeons, radiologists, and other professionals must know when AI is correct and when it is not. The same is true for lawyers, accountants, engineers, teachers, writers, and many others. Myth number 3, AI is always right. AI's greatest strength is also one of its greatest weaknesses. Because it predicts answers based on patterns, it can sometimes generate incorrect or fabricated information, known as hallucinations. Experts recommend verifying important medical, legal, and financial information through trusted sources rather than relying solely on AI. We need to think of AI as an intelligent assistant, not the final authority. Myth number 4, AI is destroying the environment. Training and operating AI systems requires significant computing power. According to the International Energy Association, IEA, data centers consume substantial electricity, and some use large amounts of water for cooling. However, there is more to this story. Many newer facilities are using recycled or non-potable water. More efficient cooling systems, renewable energy, and advanced computer chips that reduce energy consumption. AI is also helping researchers improve electrical grids, discover new medicines, optimize agriculture, and reduce manufacturing waste. Thus, like many technologies, AI creates challenges while also helping solve them. And these challenges will need to be addressed on an ongoing basis. Myth number 5. Anyone can ask AI a question and get the perfect answer. Using AI well is a skill. The quality of responses depends largely on the quality of the questions it receives. Clear instructions, thoughtful follow-up questions, fact-checking, and critical thinking often make the difference between an average answer and an excellent one. Myth number 6. AI is either good or bad. AI itself is neither. Like electricity or the internet, it is simply a tool. It can help scientists discover new medicines, improve education, detect diseases earlier, increase productivity, and make information more accessible. It can also be misused or spread misinformation, create convincing scams, invade privacy, or generate fundamental content or fraudulent content. Ultimately, people, not AI, determine whether the technology benefits or harms society. A tool, not a substitute for human intelligence. Artificial intelligence is not replacing human intelligence. It is expanding what people can accomplish when it is used wisely. AI can analyze millions of research papers in minutes, but it cannot comfort a frightened patient, earn someone's trust, recognize subtle emotions, exercise moral judgment, or replace wisdom gained through experience. As AI becomes part of everyday life, our greatest advantage will not be competing with machines, but strengthening the qualities that makes us uniquely human: critical thinking, ethics, creativity, empathy, curiosity, and sound judgment. Rather than fearing AI or blindly distrusting it, we should learn to use it thoughtfully. Like every major technological advance before it, AI has tremendous potential to improve our lives, but only if human intelligence remains firmly in the driver's seat. AI won't replace you, but someone who knows how to use it well might. Every once in a while, someone asks me the same nervous question: is AI going to take our jobs? I think the right question is simpler and harder. It's not whether AI can replace us, But who among us hasn't learned to use it effectively? Hilbert College's Institute for Applied Artificial Intelligence and the new Bachelor of Arts in Artificial Intelligence Studies are designed to ensure our students can do exactly that. Artificial intelligence is unlikely to replace all human work, but the nurse, accountant, teacher, or small business owner in Hamburg or downtown Buffalo who learns to use AI effectively may outperform someone who chooses to sit this out. At Hilbert, our goal is to ensure that students become AI fluent through their degree programs. Here is another question we consider. Can AI do this? Increasingly, the answer is yes. AI can draft emails, analyze health records, screen job candidates, and even mimic a person's voice. Capability is no longer the limiting factor. Human judgment is. The more important questions are, should we? If we should, how do we proceed responsibly with people and communities at the center? An algorithm cannot answer those questions for us. They require leadership, ethics, and human wisdom, qualities Hilbert's Franciscan humanities-rooted education has long cultivated. That is why Hilbert created the Institute for Applied Artificial Intelligence, not as another computer science lab focused solely on technology, but as a human-centered, application-focused program. It prepares students and working professionals to apply AI thoughtfully in real-world workplaces, from healthcare and not-profit organizations to manufacturing firms throughout Western New York. This spring, we built on that foundation by launching our on-campus Bachelor of Arts in Artificial Intelligence Studies. The interdisciplinary program examines AI's ethical, social, creative, and professional impacts across business, media, healthcare, and public service. Students gain hands-on experience with industry-leading AI tools, while strengthening the critical thinking, communication, and ethical decision-making skills that shape how those tools are used. You have been listening to a reading of articles and features from the August issue of Healthy Living. Your reader has been Janice. Thank you for listening.